One thing that stood out to me about this trip was just how well we as a team fit in with Global Brigade's greater model of what they refer to as the holistic model, in which we really try to ensure that our patients not only receive adequate health care, but also access to clean water and the means to start their own businesses or have access to money that they need in order to improve their quality of life. And talking to the patients, I realized that we weren't there just to show up and have a few days of clinic, and even though we did serve 700 patients during our time there, the drugs would only last for a few months. What I realized was that we were part of a much greater initiative. The patients had already received drugs before, and they were actually fairly knowledgeable about their health beyond what their education level would indicate. And it just goes to show just how effective these programs are. We also were able to visit a chicken coop that a local entrepreneur had started. He was selling the eggs and taking that money back and putting it back into the community bank, also built by Global Brigades, that would then finance other initiatives in the community. And it just made me see that these kinds of trips aren't just about providing short-term care. They're about thinking about these people and what they need, and in the end, how can we help them improve the quality of their lives in the long run for their children, for their grandchildren, etc., etc.
So one reason why I wanted to join RPP was because of the international trip. So I knew once I joined, that was something that I really wanted to do. And part of that was because I really wanted to serve in the country of Honduras, where I knew that a lot of patients did not receive the health care that they really needed. So that was something really special to me. Something other than the medical brigades that we did that was really special was we got to go see one of the local families' houses, and that was really impactful for me because just seeing kind of their conditions of living and being able to understand why they have the certain disease states that they do, such as their parasitic infections, because they don't have floors, they just live on dirt, or the water that they drink is unclean. So that was really impactful, and just to see and know the patients in a deeper level and that personal level.
Going on the Honduras trip has made me realize the disparity between the world that I live in and the world that the people in Honduras live in. One of the greatest impacts that this trip has had on me is just simply seeing with my own eyes the mud walls of their homes and the dirt floor and the bare furnishings of their house. When I went in and saw the living conditions that they had, I thought to myself, my whole room was bigger than their whole house, and that was really eye-opening.
It was one of the most amazing and life-changing experience I ever had. Even though I went to a lot of mission trips in my life, I saw them struggling with drinking water and no transportation, not even bicycle. They have to walk for hundreds of miles to go to whatever location they need, to grocery shopping, to see a nurse. They have to walk, and there's only one nurse in hundreds of miles. They have to walk to see the nurse if they need to.
Honduras was such a huge turning point in my pharmacy career. I remember going back to high school and doing all this community service. Everything was all about community service, putting service above self and helping others. And when I came to college, I didn't have a desire to do these things. So after a while, I felt like I kind of lost my way. And when pharmacy school started and everything was so fast-paced, it became all about school and all about doing well in school and making my parents proud. But I guess along the way, I kind of forgot why I wanted to be a pharmacist in the first place. And that was truly just to help people. And going to Honduras helped me remember what I've forgotten. And like during the trip, I remember visiting a man and his family where he works only minimally like in the fields and made probably $7 to feed 7 people, and that was the amount of money they had to feed the family for a week. And I remember him telling us that he had pains in his leg and that didn't allow him to walk. And I remember all of us being so concerned, telling the physician where we were holding our health fair in a sense, like a little further up, approximately a 5-minute walk from his house, and being so concerned, telling the physicians and the staff members that there's this man down in the community where how is he going to make it to our health fair? Like how is he going to come see the physician and ask for medication if he can't make the trip up? And they were not worried at all because they sent a truck down with the physician, down with students to see this man and soap him up in his home. And I guess the love that I felt from the staff members and all the students, all the passion that I was able to experience, really made the trip worthwhile for me.